Hi everyone, my name is Henry Baker, but all my friends call me Esh, and I am a registered nurse going after my master's in healthcare innovation at Arizona State University. And I'm here to chat about something pretty fascinating, at least to me right now: the use of silver versus honey for treating wounds linked to squamous cell carcinoma in our elderly patients. This is all part of my HCI 540 course this semester with Professor Driver. So, let's dive in to this intriguing topic together. Healthcare providers have been challenged to find the right dressings for wounds since, well, the first wound, I imagine, with the modern pursuit of optimal wound care dating back several decades. Advancements in the understanding of wound management and the development of more advanced wound dressings have accelerated significantly in the past few decades. Historically, healthcare providers relied on basic dressings such as gauze and bandages for wound care. While these dressings served their purpose to some extent, they often had limitations in terms of maintaining a moist wound environment, preventing infection, and promoting effective healing. Over time, research and innovation in wound care have led to the development of a wide range of advanced dressings with various properties tailored to different types of wounds and patient needs. These advancements include the introduction of hydrocolloids, hydrogels, foams, films, alginates, antimicrobial dressings, and infused dressings, among others. Despite these advancements, healthcare providers continue to face challenges in selecting the most appropriate dressing for each patient and wound type. Factors such as wound etiology, size, depth, location, presence of infection, exudate levels, patient comorbidities, and cost-effectiveness all contribute to the complexity of dressing selection. Furthermore, the emergence of multi-drug-resistant organisms and the increasing prevalence of chronic wounds, such as those associated with diabetes, vascular disease, and cancer, have added further complexity to wound management. Overall, the quest to find the right dressings for wounds is an ongoing challenge for healthcare providers, highlighting the importance of continued research, innovation, and evidence-based practice in wound care. For me, this is very personal. Seeing where my father is now, compared to the man I knew, is challenging. As a caregiver, my personal interest in treating my father's wounds associated with squamous cell carcinoma is deeply rooted in my profound commitment to family. My father, a Vietnam veteran and single parent, who also dedicated decades of his life as a lineman for the telephone company, despite his flaws, has always been a constant in my life. Now, as he faces the challenges of aging, compounded by diabetes, witnessing the impact on his life caused by poorly managed wounds is both distressing and motivating. His commitment to me, his family, his service, and all his hard work deserves reciprocation through thoughtful and effective health care. With his history as a veteran and the physical demands of his previous occupation, improving his quality of life has become not just my duty, but a tribute to his stubborn spirit. This question, the one stated in the following PICOT, has become not only a professional pursuit, but a personal vendetta to enhance the quality of life for my father and others facing similar circumstances. Wound management is a critical aspect of healthcare, particularly for elderly patients with squamous cell carcinoma. The choice of topical treatments and dressing management plays a pivotal role in promoting effective healing, preventing infections, and improving quality of life. This inquiry delves into the comparison of two prominent wound care approaches, namely silver-infused medications and dressings versus medicated honey and medicated honey-infused dressings, aiming to discern the best approach for addressing the unique needs of elderly patients with wounds associated with squamous cell carcinoma. By examining the available evidence and outcomes associated with a couple of these treatments, we hope to enhance our understanding of optimal wound care strategies, improve current wound care treatment protocols, and ultimately contribute to improved patient outcomes and satisfaction in this vulnerable population. The assembled PICOT question addresses a clinically relevant issue in wound care management for a specific population, namely elderly patients with a confirmed diagnosis of squamous cell carcinoma. This population is particularly vulnerable to complications and delayed wound healing due to age-related factors and the presence of cancer. The comparison between silver-infused products and honey-infused products is significant because both treatments are commonly used in wound care but represent different approaches with distinct mechanisms of action. Silver-infused products are known for their antimicrobial properties, while honey-infused products are recognized for their antibacterial and wound healing properties. By focusing on wound healing within a 6-month treatment period, the PICOT question addresses a practical time frame for evaluating the effectiveness of these interventions in achieving clinical outcomes. This duration allows for a comprehensive assessment of the treatment's efficacy while considering the chronic nature of squamous cell carcinoma wounds and the potential time required for healing in elderly patients. Ultimately, this PICOT question provides a clear framework for comparing two commonly used wound care interventions in a specific patient population, aiming to inform clinical decision-making and improve outcomes in the management of squamous cell carcinoma wounds in elderly individuals. Now that I had my question, I now had to do the research. With my first search, I found that I had too many filters and too narrow a focus in PubMed. This can limit research options by reducing the pool of available literature, potentially introduce bias, limit generalizability, miss opportunities for synthesis, and overlook novel insights. Ultimately, I was able to find one good research article. If I had taken this same approach in future searches, I may have overlooked valuable studies, limited the scope of analysis, and hindered the discovery of alternative perspectives or emerging trends in the field. Due to the narrowness of my search results, I had to transition from targeting elderly patients with both diabetes and squamous cell carcinoma to elderly patients with squamous cell carcinoma. This adjustment allowed for a broader exploration of relevant literature and expanded the scope of available evidence and interventions applicable to this population. While diabetes remains a significant comorbidity in wound care management, the decision to move away from it in future search criteria was an attempt to capture a more diverse range of studies and perspectives on wound healing specifically related to squamous cell carcinoma in elderly individuals. Having too many Boolean phrases in a search query can filter out results by narrowing the search too much, potentially excluding relevant studies that don't precisely match all specified criteria. This can lead to a limited pool of available literature, overlooking valuable insights, and reducing the comprehensiveness of the research findings. That is exactly what I was doing here. Using the same keywords and Boolean phrases in both CINAHL and Google Scholar searches allowed for a comparison of findings across different databases. This provided a more comprehensive understanding of the research landscape. However, the filtering in Google Scholar can be more challenging due to its broader scope and lack of sophisticated search features compared to CINAHL. This resulted in a larger volume of search results to extra time manually sifting through articles to identify relevant studies. After encountering challenges in searching through various databases for research articles, adjusting the PICOT question and refocusing its direction helped me to navigate the research process more effectively. This adjustment could involve reconsidering inclusion criteria, modifying search terms, or broadening the scope of the inquiry to capture a wider range of relevant literature. In the future, refining the PICOT question based on insights gained from the initial search process can help ensure that subsequent searches are more targeted and yield more relevant results. After putting all the pieces together in PubMed, CINAHL, and Google Scholar, I landed on the article, A Systematic Review and Meta-Analysis of Dressings Used for Wound Healing. The Efficiency of Honey Compared to Silver on Burns. As my strongest research article, the challenge became how to tie burn care and the care of wounds associated with squamous cell carcinoma together. While they may seem distinct, there are overlapping principles and strategies that can be applied across both contexts. Wound assessment and management. In both burn wounds and squamous cell carcinoma wounds, thorough assessment of wound characteristics such as size, depth, presence of necrosis, and infection risk is crucial. Management strategies may include debridement, infection control, and promotion of optimal wound healing conditions. Moist wound healing. The concept of moist wound healing is applicable to both burn wounds and squamous cell carcinoma wounds. Maintaining a moist environment can promote epithelialization, reduce pain, and minimize scarring in both types of wounds. Dressing selection. While specific wound dressings may vary based on wound characteristics and treatment goals, certain types of dressings such as hydrogels, foams, and silicone-based dressings can be beneficial for both burn wounds and squamous cell carcinoma wounds. For example, silicone dressings may help manage scar formation in burns and promote comfort in areas affected by squamous cell carcinoma. Infection control. Preventing and managing infections is critical in both types of wounds. Techniques such as regular wound cleansing, use of antimicrobial dressings, and systemic antibiotics when necessary are important strategies in both burn wound care and squamous cell carcinoma wound care. Pain management. Burn wounds and squamous cell carcinoma wounds can both cause significant pain and discomfort. Strategies for pain management may include topical analgesics, systemic medications, and non-pharmacological interventions, such as positioning and relaxation techniques. By recognizing the similarities in wound care principles and strategies between burns and squamous cell carcinoma wounds, healthcare providers can leverage their expertise in one area to inform and enhance care in the other, ultimately improving patient outcomes and quality of life. In addition, this article directly compares the effectiveness of silver dressings to honey dressings in wound care. In doing so, it offers several key benefits as a researcher. Direct comparison. Such an article provides a head-to-head comparison of two specific interventions, allowing healthcare providers to make informed decisions based on direct evidence of their comparative effectiveness. Evidence-based decision-making. Healthcare providers can use the findings from the article to guide evidence-based wound care practices, ensuring that treatment decisions are grounded in robust research. Optimal resource allocation. Understanding which dressing type is more effective can help healthcare facilities allocate resources efficiently, ensuring that patients receive the most beneficial treatment while minimizing costs. Improved patient outcomes. By identifying the dressing type that leads to better wound healing outcomes, patients can receive more effective treatment, potentially reducing healing time, complications, and overall healthcare burden. Guidance for clinical practice. The article can serve as a valuable reference for clinical practice guidelines and protocols, informing best practices in wound care management for various patient populations and wound types. Overall, a Level 1 article like this can provide valuable insights that can significantly impact clinical decision-making, resource allocation, and patient outcomes in healthcare settings. After the strong start with Article 1, it seemed like finding equally strong research tying wound care, silver dressings, honey dressings, the elderly, and especially diabetes became just way too focused, even after weeding out diabetes as a filter. Finding research tying wound care and cancer was a challenge. Ultimately, the research began to broaden out and focus more on the dressings and dressing treatments as a whole. The next article I landed on was Wound Dressings and Comparative Effectiveness Data: Advances in Wound Care by Sud and Tomaselli. Although not the strongest research, as a Level 4, it has strong enough ties to the research I have in mind. As we quickly look through the outcome measures, we can see how research regarding wound care in general and proper dressing selection can affect the wound healing rate, wound size reduction, pain relief, infection control, patient satisfaction, and cost effectiveness. These measures can then directly assess the effectiveness, safety, and patient experience associated with the use of silver and honey dressings in wound management for future research and/or in direct patient practice. When exploring the continuum of care, we see that it refers to a patient-centered approach that ensures seamless coordination of healthcare services across different levels and settings. In the context of dressing selection, it involves the ongoing assessment, implementation, and evaluation of evidence-based practices to promote optimal wound healing. Healthcare providers consider factors such as wound characteristics, patient preferences, and cost-effectiveness when choosing between silver and honey-based dressings. Silver dressings are known for their antimicrobial properties, while honey-based dressings offer anti-inflammatory and wound-healing benefits. This selection depends on individual patient needs and the specific goals of wound management within the continuum of care, which seems to be the perfect segue to the final research article we will be discussing. The Level 5 research article, Intervention for Symptom Management in Patients with Malignant Fungating Wounds, a Systematic Review, helps to bridge two of the primary aspects of the PICOT question: silver versus honey-based wound care and the care of patients with squamous cell carcinoma. Fungating wounds often result from advanced malignancies like squamous cell carcinoma. Squamous cell carcinoma, a type of skin cancer, can progress to form fungating wounds characterized by ulceration and tissue necrosis. These wounds can be malodorous, exudative, and painful, impacting the patient's quality of life. Treatment typically involves a multidisciplinary approach focusing on symptom management, including malodor, exudate, and pain control. Dressings such as silver and honey-based dressings are commonly used to address these symptoms and promote wound healing. However, the management of squamous cell carcinoma and its associated fungating wounds requires a tailored approach, considering the individual patient's medical history, tumor characteristics, and treatment goals. The outcome measures listed focus on symptom management, including malodor, exudate, pain, bleeding, and myiasis in patients with malignant fungating wounds, or MFWs. Both silver and honey dressings have demonstrated effectiveness in reducing malodor and exudate, which are common symptoms associated with MFWs. Silver dressings, with their antimicrobial properties, are particularly effective in this regard. Pain management strategies, such as opioid administration, are crucial for improving patient comfort and quality of life, while honey dressings may provide some analgesic effects. Further investigation into alternative methods like medical cannabis is warranted. Bleeding management remains understudied, with limited evidence available for effective interventions. Additionally, interventions for myiasis management focus on mechanical removal of larvae and wound rinsing with antiseptic solutions, rather than specific dressing selection. Overall, both silver and honey dressings offer benefits in symptom management for patients with MFWs, with considerations for individual patient needs and preferences. The similarities across the three articles include their comprehensive approach to reviewing literature and providing practical insights for clinicians. Each study emphasizes evidence-based practices and evaluates the quality of available evidence, whether through systematic reviews, critical analysis, or multidisciplinary collaboration. They all offer clear objectives and consider various factors relevant to wound management, such as wound characteristics and comparative effectiveness research. Additionally, they underscore the importance of synthesizing evidence to inform clinical decision-making and improve patient outcomes, highlighting the need for continued research and collaboration in wound care. After navigating through all that data, it's time to refocus on our initial PICOT question. In patients over 65 years of age with a confirmed diagnosis of squamous cell carcinoma, how does the efficacy of silver-infused medications and/or dressings compare to honey-infused medications and/or dressings in influencing wound healing within a 6-month treatment period? This concise restatement reaffirms our research focus and guides our final step in synthesizing and analyzing the gathered information. Our research question can be restated as follows. How does silver-infused medications and/or dressings compare to honey-infused medications and/or dressings in influencing wound healing within a 6-month treatment period for patients greater than 65 years of age with a confirmed diagnosis of squamous cell carcinoma? Based on available evidence, honey wins. In the end, honey-infused dressings would demonstrate faster wound healing and reduced bacterial presence compared to silver-infused dressings in elderly patients with squamous cell carcinoma within a 6-month treatment period. Given the evidence favoring honey-infused dressings for wound healing in this specific population, clinicians should consider incorporating honey-based dressings as a primary choice for managing wounds associated with squamous cell carcinoma in elderly patients. This decision aligns with evidence-based practice paradigms and aims to optimize patient outcomes by promoting faster wound healing and reducing bacterial burden. Healthcare providers, particularly those caring for elderly patients with squamous cell carcinoma, should stay informed about the latest evidence regarding wound dressings. Further research may be warranted to explore additional factors influencing wound healing and to validate the findings of existing studies. Additionally, interdisciplinary collaboration among healthcare professionals, including wound care specialists, oncologists, and diabetes specialists, can facilitate comprehensive care and improve patient outcomes. Continuous education and training programs can equip clinicians with the knowledge and skills needed to implement evidence-based wound care practices effectively. That's it, folks. I hope you enjoyed the presentation as much as I have enjoyed putting it together. And I hope that you have found the information as interesting as I did. I know these things can kinda drone on sometimes. I truly want to thank you all for your time and attention, and I am wishing you the best of luck in your studies. For those of you who are interested, there is one more slide. We go from talking about silver and honey and wounds and squamous cell carcinoma, blah blah blah, and instead talk about an elephant. Either way, thank you for your time and take care. Now let's deal with the elephant in the room. At least as I saw it when putting this presentation together. The lack of significant research focusing on the specified population and time frame in the PICOT question highlights a gap in the current literature regarding wound management in elderly patients with squamous cell carcinoma. Despite the prevalence of this demographic group and the importance of wound healing within a relatively short time frame of 6 months, there appears to be limited investigation into the comparative effectiveness of silver-infused versus honey-infused medication or dressings specifically for this population and duration of treatment. This gap underscores the need for further research to address the specific needs and challenges faced by elderly patients with squamous cell carcinoma, particularly in terms of optimizing wound care and promoting healing within a realistic time frame. Unfortunately, to close the gap in the PICO, I had to use some inferred data. The use of inferred data in clinical research involves drawing conclusions or making predictions based on indirect or implicit information gathered from study participants. This data may be derived from observations, patterns, or correlations within the collected dataset. Inferred data can provide valuable insights into underlying trends or associations that may not be directly measured or observed. However, it's essential to interpret inferred data cautiously, considering potential biases and limitations in the study design and analysis methods. Transparent reporting and validation of inferred conclusions are critical for ensuring the reliability and validity of clinical research findings. In this case, I was able to infer, based on the data, that honey-based dressings would be more effective over a 6-month period in the treatment of wounds associated with squamous cell carcinoma in patients greater than 65 years old. Subject age and set time frames for results are often considered essential factors in wound healing and its subsequent research. This makes it a bit easier to infer findings across other research data. On the other hand, comorbidities like diabetes and squamous cell carcinoma are studied independently of each other, and the ability to infer findings is not strong enough. Simply put, I had to choose which direction I wanted to go in and refocus my PICOT. Ultimately, my research could have just as easily focused on diabetes rather than squamous cell carcinoma, given the significant impact of diabetes on wound healing outcomes. Tailoring research towards diabetes could explore the specific challenges and interventions related to wound care in diabetic patients, providing valuable insights into optimizing treatment strategies for this population. In the end, I would still need to make inferences to answer my research question. Thank you again, folks, and please feel free to look through my references.